Heart disease is still the #1 global killer in the world. Can you reverse the disease that kills more human beings than any other? Reverse the plaque that clogs your arteries? Not just slow it down, not just manage it, but actually reverses it? This question has haunted cardiology for over half a century. Pharmaceutical industry has spent $300 billion a year trying. They have produced 3 landmark drugs with 3 landmark trials. But while the world was watching those trials, something remarkable was happening in smaller laboratories with simpler interventions, producing results that in many cases exceeded the drugs. I'm Dr. Kevin Ham. I'm a physician, but I'm also a patient with severely clogged arteries, 77% and so on, in all my vessels. Today I'm going to put the 3 most powerful cholesterol drugs ever created head to head against 3 foods. I will show you every number and I will explain how they each work. Before we compare drugs to foods, you need to understand what we are actually fighting, because most people think plaque is cholesterol stuck to an artery wall, like grease in a pipe. That's the wrong picture. And that misunderstanding is why most people fail to reverse plaque. Here's what actually happens. Your arteries are lined with a single layer of cells called the endothelium. Think of it like living wallpaper. It's very thin. And when that wallpaper gets damaged by high blood pressure, smoking, high blood sugars, it develops tiny gaps. LDL particles small enough to slip through those gaps enters the arterial wall. And the moment they cross that barrier, something changes. If you're in an inflammatory state, these LDL get oxidized, chemically altered, and oxidized LDL is what your immune system treats as a threat. Your body sends in macrophages, the immune cells whose job is to eat these invaders. The macrophages engulf the oxidized LDL, but they can't digest it. They swell, they become what pathologists call foam cells. Bloated, immobile, and trapped inside the arterial wall. When enough foam cells accumulate and die, they form a necrotic core, a pool of dead cellular debris, sealed beneath a thin fibrous cap. This fibrous cap is thinner than a hair, and that's plaque. And if that cap ruptures, the contents of that plaque spill into the bloodstream and trigger a clot in the artery. And that clot blocks the artery and causes a heart attack. So the disease is not cholesterol on a wall. It's an immune response gone wrong inside the wall of the artery. And that distinction matters greatly because it tells you exactly what a successful intervention must do. It must first stop the oxidation, resolve the inflammation, and activate the pathway that removes cholesterol from those trapped macrophages. That pathway is called reverse cholesterol transport and is the central target of everything I'm about to show you. So let's begin with what modern pharmacology can do at its absolutely best, the drugs. Rosuvastatin, high-dose statin, 40 milligrams once a day. In the Asteroid trial in JAMA in 2006, 349 patients took the maximum dose of the most powerful statin for 2 full years. LDL fell from 130 milligrams per deciliter down to 61. A 53% reduction, pretty good. HDL rose from 43 to 49, and imaging showed a 0.98% decrease in the volume of plaque. That's just 1% inside their coronary arteries. It was the first time a statin had ever demonstrated regression, just 1%. Yet the field cardiology celebrated 1% decrease in 2 years. I see it more like an arrest of the plaque of the disease than a reversal. Then came the more powerful LDL-lowering cholesterol drugs, PCSK9 inhibitors, evolocumab or Repatha. The Glagov trial in JAMA 2016, 968 patients already on statins received a monthly injection on top. After 76 weeks, LDL plummeted to a low of 36.6, the lowest level ever achieved in any clinical trial. This 36.6 is equal to just under 1.0 millimolar in Canadian terms. Plaque volume decreased 0.95%, about the same as a previous statin study on rosuvastatin. 64% of patients showed this slight regression. The cost? $14,000 a year. Even with such drastic lowering of LDL down to 36, not much more plaque volume decreased. It seems lowering LDL arrests disease progression at a certain point, but doesn't truly or remarkably reverse it. In the Odyssey outcome trials in the New England Journal of Medicine 2018, nearly 19,000 patients after acute coronary syndrome or heart attack, LDL fell from 87 to 53. Major adverse cardiovascular events fell 15%. All-cause mortality fell 15%. This was the first PCSK9 trial to show that patients actually lived longer. Those are the 3 most powerful results in the history of lipid-lowering therapy. So how does this work? Inside every cell in your body runs a metabolic highway called the mevalonate pathway. At the top of that highway sits a single enzyme, the HMG-CoA reductase. And statins block that enzyme, and when they do, they block cholesterol production, but not just cholesterol, but everything else the highway produces. And it produces something called coenzyme Q10, and this is the molecule your mitochondria need to generate energy. There's also a substance that's essential to the integrity of the cell membranes. It's a steroid hormone precursors that are also blocked. The raw material your body uses to build cortisol, testosterone, and estrogen. So cholesterol is not merely a villain in the bloodstream. It is a structural backbone of every steroid hormone in the human body, in every cell. PCSK9 inhibitors work by an entirely different logic. Your liver has called LDL receptors on its surface. These are like molecular garbage trucks that reach into the bloodstream, grab the LDL particles, and pull them inside for disposal. A protein called PCSK9 destroys these LDL receptors after each use. So the PCSK9 inhibitors block that destruction of these receptors. There's more receptors that survive, more LDL gets cleared and disposed of. The elegance is that this mechanism never touches the mevalonate pathway at all. So statins shut down an entirely different metabolic highway. PCSK9 inhibitors simply save the LDL cholesterol cleanup crew. Because of these mechanisms, there's side effects that follow like a shadow follows a body. It's muscle pain, muscle fatigue, muscle weakness. CoQ10 drops roughly 50% within 14 days of high-dose atorvastatin. Without CoQ10, mitochondria cannot make energy well. You feel fatigue, weakness, pain in your muscles. And so 10 to 25% of patients in real-world practice, they stop the statin because of that pain or discomfort. In the brain, the FDA issued a safety warning for confusion and memory loss. This affects the myelin sheath of neurons that conduct the nerve transmission in the brain. Peripheral neuropathy, depression, personality changes appear in some of the studies and data for side effects for this. And the sex hormones, so with less substrate flowing through the pathway that's blocked, its raw materials for cortisol, testosterone, estrogen decrease. In a cohort of over 107,000 patients, just over 10%, 10.3% discontinued the statin. 60% of former users say side effects are the reason they stopped. And PCSK9 inhibitors, because they leave the cholesterol synthesizing pathway untouched, they have a different side effect profile, 34%, but the steroid hormones, vitamin E, and the sex hormones were unaffected with the PCSK9s, even at LDL levels below 15. And there was no increase in diabetes, no formal cognitive impairment with the PCSK9. So even with severely low LDL, it didn't impact their brain function or their sex hormones. Now, quick question before we go on. Have you experienced statin side effects if you're taking a statin? Or are you on a statin with no issues? I want to hear what you have to say and what your experience is. So just drop your answer in the comments below. I'll try to read every single one of them because I want this insight. Back to the story. So let's look at the 3 foods now. Now consider what food can do. Not food as a vague lifestyle recommendation that many people give you, but food as a pharmacological intervention, tested and studied. Food like a medicine. I've talked about many foods like this in the past, but let's review. Pomegranate juice. Avram, in Clinical Nutrition, the journal, in 2004, he showed 19 patients with pretty severe carotid artery blockages, 70 to 90%, and he drank 50 milliliters of pomegranate juice daily. This is cold-pressed, concentrated pomegranate juice. And after just 1 year, carotid intima media thickness, the thickness of the carotid artery wall, decreased by 30%. It's quite significant. And in the control group, who never drank the pomegranate juice, their thickness increased by 9%. This was clearly beneficial. LDL oxidation, the culprit of oxidized LDL, fell by 90%. the chemical process that transforms cholesterol from a benign passenger into a driver of disease, 90% reduction. There's an enzyme that protects HDL and activates reverse cholesterol transport, pulling cholesterol out of the plaque back into the blood to be excreted. This is peroxidase 1. This surged 83% with pomegranate juice. And as an added bonus, systolic blood pressure dropped 12%. This is better than most anti-high blood pressure medications. And total antioxidant status rose 130%. So just 50 milligrams of pomegranate juice for 1 year, few dollars a week. Second food I've talked about, nattokinase. Chen did a study with 1,062 patients in China, published in the Frontiers in Cardiovascular Medicine. It was the largest nattokinase study ever published. And these participants had high lipids, high cholesterols, or early carotid plaque. They gave them 10,800 fibrolytic units per day for 12 months. Carotid intima media thickness decreased by up to 36%, and plaque size both decreased significantly. Improvement rates range from 66 to 95%. Here's the finding that changes the conversation. At 3,600 fibrolytic units per day, so about 1/3, nattokinase was completely ineffective. So what that tells you is that the dose really matters. You need at least 6,000 fibrolytic units, and this study was done at 10,800 fibrolytic units. If you're not on a blood thinner, you can supplement to this level. Otherwise, consult your physician. And if you just eat the natto, the food, the beans, fermented soybeans, just 2 tablespoons a day delivers you 300 to 500 micrograms of vitamin K2, which puts calcium not in your arterial walls, but in your bones and in your teeth. And this is the long-acting form called the MK7 form. And there's also something called spermidine, which is a polyamine that activates something called autophagy that gives you cellular repair. And this is highly touted for longevity. Okay, the third food, steel-cut oats. Tuari and Cummins did a meta-analysis, which is a look at all the studies that they can find, and published it in the American Journal of Clinical Nutrition in 2011. They looked at 28 randomized controlled trials, 3 grams of beta-glucan daily, which is 1 bowl of steel-cut oats, and it reduced LDL by 6 to 8% on average. And the mechanism is purely mechanical. Beta-glucan in this oats binds bile acids in the gut and forces the liver to pull LDL from the bloodstream to synthesize more bile acids. So it's consistent, it's dose dependent, and it's cross populations. And what's the side effects of foods? In pomegranate, nothing really. Antioxidant status increased 130%, systolic blood pressure dropped 12%, and the enzyme that drives reverse cholesterol transport surge. What's the side effect for nattokinase? Well, in the study, they had no adverse events in 1,062 participants over a year. But we must caution that if you're on blood thinners, this increases your risk of hemorrhage. So please consult your physician before you go on nattokinase or supplement with it if you're on any blood thinner. And the side effect of oats? Well, again, not really any. You get improved gut microbiome, better glycemic or glucose control, you feel satiety or fuller. The side effects of these foods are additional health benefits. So here's how they stack up. Rosuvastatin 40 milligrams. LDL went from 130 to 61, 53% reduction. Plaque minus 0.98% in 24 months, so 1% regression. Side effects, muscle pain in 10 to 25%, CoQ10 down 50%. The PCSK9 inhibitors, LDL went from 93 to 36, a 60% reduction. Plaque was still 0.95% in 76 weeks. Side effects for injection site reactions, high costs at $14,000 a year. There was 15% fewer major cardiac events, 15% reduction in all-cause mortality. So, had its benefits, some side effects. And the foods? Let's review. Pomegranate, just 50 mils a day. LDL oxidation down 90%. The intima media thickness down 30% in 1 year. Side effects? Well, nothing really. Blood pressure dropped 12%, antioxidant status went up 130%. Nattokinase 10,800 fibrolytic units a day. Lipids improved. Plaque and intima media thickness reduced improvements greatly. And just a warning if you're on blood thinners. So I'm not telling you to discard your prescription if you're already on one of these statins or PCSK9s. If your cardiologist prescribed you that statin, that conversation belongs between you and your doctor. In fact, if you add these 3 foods and keep taking your statins, you will see your cholesterol decline even further. My friend, 71-year-old, who was on a rosuvastatin, it declined 71% in 3 weeks, from 107 down to 34, just as good as the PCSK9s. What I am telling you is this: the evidence for food, the effect sizes are larger. The question is not drugs or food. The question we should all be asking is, why are not we doing both in severe situations, severe disease? So comment below, are you doing both drugs and healing foods? So everything I showed you today, every study, every dose, the full protocol, it's at ham.com. Link is in the description. I'm Dr. Kevin Ham. I was trained as a physician, but I'm also a patient, experimenting and showing you the results that I've obtained. And I want to empower people like me, like you, with health education to reverse their illnesses. I'm not just reversing my own heart disease, I'm helping others reverse not only their heart disease, but their high blood pressure, the diabetes, their visceral fat, and high cholesterol, naturally and quickly. So empower yourself, take control of your own health.
These videos save lives. Tag me, like, subscribe, and ask your questions below. Click one of these videos and share it with someone you love. Together, we will save lives. For my up-to-date learnings and more, visit me at ham.com.